Hello, everyone. Today we're going to explore an extremely common yet often misunderstood problem, pain in the front part of the knee, and how it can actually originate from the lower back, even when the back itself doesn't hurt. We'll break down why this happens, how to recognize it, and what you can do to fix it. Why pain appears in the front of the knee. Pain in the front of the knee usually comes from the patellofemoral joint, the connection between the kneecap, patella, and the femur. If you study this area anatomically, you'll notice something important. The groove on the femur, the shape of the patella match each other perfectly. When the kneecap glides smoothly in that groove, the cartilage distributes pressure evenly and works without problems. But this ideal movement depends on many factors: muscles, nerves, foot mechanics, hip position, and even the spine. And this is where things get complicated. 2. Ascending and descending causes. Ascending factors, coming from the foot. If the foot collapses inward, valgus, or overpronates, or has weak stabilizing muscles, the tibia rotates abnormally. This rotation changes the alignment of the patellofemoral joint, increasing stress on the kneecap. Descending factors, coming from the hip and above. Rectangle, quadriceps imbalance. The quadriceps tendon forms the upper attachment of the kneecap. The patella is literally a hardened piece of that tendon. Quadriceps has 4 heads. 2 vertical heads determine the height of the patella. 2 side heads act like reins. They pull the patella left or right. If these heads work unevenly, the kneecap glides incorrectly, causing irritation, pain, and overload. Rectangle, weak glutes. The gluteus maximus and gluteus medius hold the femur in proper alignment. If these muscles are weak, the femur rotates inward, the patella shifts off its optimal track, joint geometry changes, cartilage pressure increases. Rectangle, tight or weak adductors. Tight adductors pull the knee inward during walking or squatting. Weak adductors make the knee unstable. Both disrupt the kneecap's movement. Rectangle, hamstring weakness. If the hamstrings don't support the backside of the thigh, the quadriceps overworks. The kneecap is pressed too firmly against the femur. Pain and inflammation increase. 3. Why the knee is a collector of problems. The front of the knee accumulates. Muscle imbalances of the thigh, foot misalignment, pelvic instability, nerve dysfunction from the spine. In most cases, the solution is restoring balance, strength, and flexibility in all these regions so the leg moves straight without rotations or side shifts. This is why treatment usually includes myofascial release, therapeutic exercises, massage, nerve mobilization, spine mechanics correction, but about 15% of cases come from a completely different mechanism. 4. When the real cause is the lower back, even if it doesn't hurt. Sometimes the problem is not in the muscles, but in the nerve that activates them. When a nerve is slightly compressed, irritated, or poorly conducting signals, the muscle doesn't work at full strength. It may turn on too late, too weakly, or unevenly. And because the nerves to the quadriceps, hamstrings, and glutes come from the lumbar spine, even a minor lumbar dysfunction can lead to altered muscle activation, imbalance between muscle groups, incorrect patellar movement, front knee pain. The surprising part? The lower back does not have to hurt at all. Many people with clear lumbar origin knee pain report 0 back discomfort. This is purely a nerve conduction problem. 5. How to know if your knee pain comes from the lower back. There are several diagnostic signs. 1. Your knee moves fully and freely when relaxed. If someone moves your knee passively, it bends easily, it straightens easily, nothing is physically stuck. But pain appears only during active movement, when muscles activate. That's a hallmark sign of nerve involvement. 2. Neurological sensations besides pain. These may appear heaviness, mild numbness, tingling, filling or pressure inside the knee without visible swelling. Symptoms often worsen after sitting, improve after walking, appear on both knees at the same time. This symmetrical pattern often indicates a lumbar source. 3. The pain is inconsistent. One day your knees feel perfect. You can squat, walk, climb stairs. The next day the pain appears even with minimal activity. This fluctuation is typical for nerve-related problems. 4. You've had back or sciatic issues in the past, even if it was years ago, even if it disappeared. Old lumbar injuries reduce nerve tolerance and create long-term vulnerability. But again, you can have lumbar origin knee pain without ever having back pain at all. 5. The most important sign, the test exercise. This is the key diagnostic tool. Here's what you do. Perform a movement that causes knee pain, for example, a squat. Feel the discomfort clearly. Do a lumbar spine exercise. Repeat the squat. If the pain decreases by at least 30%, the knee problem is coming from the lower back. This is the strongest confirmation. 6. What exercises help? If the pain is on both sides, use Mackenzie lumbar extensions, back bending while lying on stomach. These exercises decompress the nerves and restore proper activation. If the pain is on one side, use a lumbar twist toward the painful side, holding it for 2 minutes. This technique is often shown as a sciatica relief exercise, but it helps with nearly all nerve-related leg symptoms. 7. Mixed causes are common. For example, 20% from the foot, 20% from tight muscles, 60% from the lower back. Usually, after treating the lumbar component, symptoms become more predictable, pain decreases, but smaller biomechanical issues remain. At that point, you continue with strengthening weak muscles, stretching tight ones, restoring proper movement patterns. But always, first fix the lower back, then train the knee safely. 8. Real clinical examples. In my Telegram channel, I will share detailed real cases, before-after improvements, diagnostic tests, specific exercises used, and how patients recovered. Feel free to join and learn from real-life examples. Stay healthy, take care of your knees, and never ignore the role of the spine.